Question 1. Given the circumstances where a 65-year-old female patient with a history of hypertension presents for a IK of the abdomen with intravenous contrast, which of the following is the most important factor for the technologist to assess before proceeding with the examination? A. Ensure that the patient is positioned correctly for optimal image quality. B. Confirm the patient's renal function and assess the risk of contrast-induced nephropathy. C. Verify the patient's medical history and ensure they are not claustrophobic. D. Determine whether the patient is allergic to iodine-based contrast media. Answer. Correct answer. B. Confirm the patient's renal function and assess the risk of contrast-induced nephropathy. Explanation. In this scenario, the patient is at risk of contrast-induced nephropathy, SIN, especially given her hypertension and age. It is essential to assess renal function before administering intravenous contrast because compromised renal function can increase the risk of SIN. The technologist should review the patient's laboratory results, e.g. serum creatinine, glomerular filtration rate, to ensure the kidneys can safely filter out the contrast. Additionally, pre-contrast hydration may be required to further reduce the risk. While allergies to iodine contrast and positioning are important, renal function assessment is the most critical in this context. Question 2. During a procedure for a 12-year-old patient with a suspected brain tumor, the technologist notices signs of anxiety and claustrophobia. What is the best approach to mitigate the patient's anxiety and ensure a successful exam? A. Explain the procedure in detail to the patient, emphasizing how quick the scan will be. B. Use sedation medication to help the patient relax during the procedure. C. Allow a family member to accompany the patient in the scan room to provide comfort. D. Continue with the scan, reassuring the patient that the anxiety is normal. Answer. Correct answer. C. Allow a family member to accompany the patient in the scan room to provide comfort. Explanation. Pediatric patients often experience increased anxiety and claustrophobia during CT procedures due to the enclosed nature of the scanner and the need to remain still. The presence of a familiar family member can significantly reduce anxiety and help the patient feel more secure. While sedation could be an option in some cases, it introduces additional risks and should be considered after evaluating the patient's condition. Reassuring the patient verbally may not always be sufficient, especially in the case of young children. Question 3. When analyzing the radiation dose delivered during the technologist should consider which of the following to minimize unnecessary radiation exposure while maintaining image quality. A. Increasing the mass value to ensure optimal image quality. B. Adjusting the scan field of view (SFOV) to include only the area of interest. C. Using a higher kVp to reduce patient exposure. D. Increasing the slice thickness to reduce scan time. Answer. Correct answer. B. Adjusting the scan field of view (SFOV) to include only the area of interest. Explanation. Adjusting the scan field of view (SFOV) is a critical step in minimizing radiation exposure while ensuring sufficient image quality. By limiting the SFOV to the area of clinical interest, unnecessary radiation exposure to adjacent tissues is minimized. Increasing mass or using higher kVp can lead to unnecessary dosing without providing proportional improvements in image quality. Slice thickness and scan time are related to image resolution, but adjusting SFOV is the most effective means of reducing dose in this context. Question 4. In a case of a 40-year-old male patient who requires a chest CT, which of the following is the most important consideration when performing the exam in terms of radiation protection? A. Use automatic exposure control to adjust radiation dose. B. Utilize the highest possible kVp to reduce radiation dose. C. Ensure the patient remains immobile to reduce motion artifacts. D. Apply bismuth shielding to protect the thyroid and breast tissue. Answer. Correct answer. D. Apply bismuth shielding to protect the thyroid and breast tissue. Explanation. In chest CT, sensitive organs such as the thyroid and breast tissue are exposed to radiation. To protect these organs, the use of bismuth shielding is recommended, while automatic exposure control helps in optimizing the dose. Applying additional shielding is a direct method to reduce radiation exposure to sensitive areas. Using high kV does not reduce radiation dose. In fact, it may increase it. Motion artifacts are a concern, but the primary focus in this case should be on radiation protection. Question 5. What is the primary principle behind the ALRT, as low as reasonably achievable, concept in radiation protection during CT scans? A. Maximizing image quality at the expense of patient dose. B. Ensuring that all CT exams are performed without any radiation exposure. C. Minimizing radiation exposure while maintaining diagnostic image quality. D. Using high doses of radiation for faster imaging results. Answer. Correct answer. C. Minimizing radiation exposure while maintaining diagnostic image quality. Explanation. The ALRT principle emphasizes minimizing radiation exposure to the patient while ensuring that the diagnostic quality of the image is maintained. This is achieved through optimization of scan parameters, proper use of shielding, and minimizing unnecessary scans. The concept does not advocate for zero radiation, but encourages the lowest radiation dose necessary to obtain clinically relevant information. High doses and maximizing image quality at the expense of dose contradict the core of ALRT. Question 6. When preparing a patient for ARRT with oral contrast media, the technologist should be aware of which of the following considerations. A. Oral contrast agents should be administered immediately before the scan to maximize absorption. B. Patients should be instructed to drink the contrast agent slowly over a period of 30 minutes to ensure adequate distribution. C. Oral contrast should only be used in patients with a history of gastrointestinal disorders. D. The patient should be instructed to drink a large volume of oral contrast after the scan is completed. Answer. Correct answer. B. Patients should be instructed to drink the contrast agent slowly over a period of 30 minutes to ensure adequate distribution. Explanation. For CT scans that require oral contrast, the technologist should instruct the patient to drink the contrast agent slowly and allow adequate time for it to distribute through the gastrointestinal system. This ensures that the contrast reaches the relevant areas for imaging and better diagnostic results. Administering it immediately before the scan may not allow sufficient time for the contrast to spread. Oral contrast is used in a variety of clinical conditions, not just gastrointestinal disorders, and should be taken before the scan, not after. Question 7. During a ICAN, if the technologist suspects that a patient has an extravasation of contrast media, what is the most appropriate first step in management? A. Continue the procedure without interruption to avoid patient discomfort. B. Immediately notify the radiologist and prepare for additional imaging. C. Remove the intravenous Roman access and apply cold compressors to the affected area. D. Document the incident and inform the patient after the scan is completed. Answer. Correct answer. C. Remove the intravenous Roman access and apply cold compressors to the affected area. Explanation. Extravasation occurs when contrast media leaks out of the vein and into surrounding tissues. The first step is to remove Roman access to prevent further leakage, then apply cold compressors to reduce swelling and discomfort. Notifying the radiologist may be necessary later, but immediate intervention is required to manage extravasation. Continuing the procedure without addressing the issue could worsen the situation. Question 8. In the context of CT imaging, which of the following is the most accurate method for reducing motion artifacts? A. Administering a sedative to the patient before the scan. B. Increasing the scan speed and using a higher kVp. C. Providing clear instructions for the patient to hold their breath and remain still. D. Using a larger scan field of view (SFOV) to encompass the area of interest. Answer. Correct answer. C. Providing clear instructions for the patient to hold their breath and remain still. Explanation. Motion artifacts are one of the most common sources of image degradation in CT. The most effective way to minimize these artifacts is to instruct the patient clearly to hold their breath and remain as still as possible during the scan. While sedation may be considered for some patients, it is not always necessary and introduces additional. Increasing scan speed or using a larger SFOV does not necessarily reduce motion artifacts and may increase radiation exposure. Question 9. In the context of CT angiography, ETA, which of the following factors is most crucial to ensure optimal image quality and accurate diagnosis? A. The administration of contrast media at the appropriate rate and timing. B. Reducing the scan time by using a higher pitch setting. C. Using a low kVp setting to reduce radiation exposure. D. Increasing the slice thickness for better visualization of vessels. Answer. Correct answer A. The administration of contrast media at the appropriate rate and timing. Explanation. In a TA, contrast media is essential to visualize blood vessels clearly. The correct rate and timing of contrast administration ensure that the contrast is in the desired vascular region during imaging, allowing for optimal visualization of the vasculature, while reducing scan time and adjusting slice thickness are important. The timing of contrast injection is the most critical factor in obtaining high-quality images for diagnostic purposes. Question 10. What is the primary purpose of using iterative reconstruction techniques in CT imaging? A. To increase the radiation dose while improving image clarity. B. To reduce the amount of raw data needed for image reconstruction. C. To reduce image noise and improve image quality at lower doses of radiation. D. To allow for faster image processing and quicker results. Answer. Correct answer. C. To reduce image noise and improve image quality at low doses of radiation. Explanation. Iterative reconstruction techniques are used to improve image quality while reducing the radiation dose required for CT scans. These techniques work by iterating through the data to reduce noise and enhance the clarity of the images, which helps in obtaining high-quality images at low doses of radiation. Increasing radiation reducing raw data is not the goal of iterative reconstruction. Rather, it aims to maintain or enhance image quality with reduced exposure. Question 11. In the context of pediatric CT procedures, a radiologic technologist is preparing for an abdominal CT scan of a 5-year-old child. Which of the following is the most important consideration in ensuring the child's safety and minimizing radiation exposure? A. Use the adult CT protocol, adjusting only for the patient size. B. Perform the CT scan without considering any adjustments to radiation dose. C. Adjust the radiation dose based on the child's size and body habitus. D. Increase the mass settings to improve image quality. Answer. Correct answer. C. Adjust the radiation dose based on the child's size and body habitus. Explanation. Children are more sensitive to radiation than adults due to their rapidly dividing cells and smaller body size. Pediatric CT procedures should always follow specialized pediatric protocols to ensure that the radiation dose is minimized while maintaining diagnostic image quality. Adjusting the radiation dose based on the child's size. Body habitus helps in applying the ARRT as low as reasonably achievable principle, which is fundamental in radiation protection. Standard adult protocols may expose pediatric patients to unnecessary and potentially harmful radiation levels. Increasing mass, option D, is typically not recommended as it could increase unnecessary radiation exposure, and using the adult CT protocol, option A, without adjustments would not be ideal. Children. Question 12. When considering patient identification and verification procedures, which of the following is the most critical step to prevent errors in a ECG? A. Verify patient identity using only their date of birth. B. Cross-check patient identification with at least 2 unique identifiers, name, date of birth, or medical record number. C. Rely solely on the patient's verbal confirmation for identity. D. Skip verification if the patient is already familiar to the technologist. Answer. Correct answer. B. Cross-check patient identification with at least 2 unique identifiers, name, date of birth, or medical record number. Explanation. Patient identification is a crucial step in preventing medical errors and ensuring patient safety. The standard practice in healthcare, including CT procedures, is to verify patient identity using at least 2 unique identifiers, e.g., name, date of birth, or medical record number. Process significantly reduces the risk of mistaken identity, especially in busy healthcare settings. Relying only on verbal confirmation, option C, or assuming familiarity with a patient, option D, can lead to misidentification and potentially dangerous outcomes. Verifying only one identifier, such as the date of birth, option A, is insufficient and could increase the risk of errors. Question 13. Given the circumstances of a patient with a known allergy to iodine-based contrast media, what is the recommended protocol for A. Key with contrast. A. Proceed with the CT scan without contrast, as iodine-based contrast should be avoided entirely. B. Use a non-iodine contrast agent after verifying its safety with the physician. C. Administer the iodine-based contrast agent after pretreatment with antihistamines. D. Perform a thorough patient history and reconsider contrast administration based on the patient's medical history and symptoms. Answer. Correct answer. D. Perform a thorough patient history and reconsider contrast administration based on the patient's medical history and symptoms. Explanation. For patients with a known allergy to iodine-based contrast media, the primary concern is ensuring patient safety by evaluating the severity of the allergy and determining the best course of action. In cases of mild allergies, premedication with antihistamines, option C, may be considered. However, for severe allergies, non-iodine contrast agents, option B, or even the decision to perform the scan without contrast, option A, might be necessary. A comprehensive review of the patient's medical history, option D, is the most important step to ensure appropriate contrast selection, risk assessment, and planning for the procedure. Question 14. According to recent studies, how should CT technologists address patient anxiety and claustrophobia during a scan? A. Explain the procedure briefly and proceed with the scan, reassuring the patient minimally. B. Use medication to sedate the patient prior to the procedure to ensure they stay calm. C. Offer the patient a calm and reassuring environment, providing clear explanations and a call bell to stop the scan if necessary. D. Require the patient to undergo the procedure without any sedation, as this is part of the diagnostic process. Answer. Correct answer. C. Offer the patient a calm and reassuring environment, providing clear explanations and a call bell to stop the scan if necessary. Explanation. Managing patient anxiety and claustrophobia in CT procedures is essential to ensure the patient remains still during the scan for optimal image quality. Effective communication plays a crucial role in calming the patient, explaining the process thoroughly, and allowing them to have control the situation, such as providing a call bell to stop the scan, option C, while sedation, option B, may be appropriate in some cases. It is not the first line of action, and it is generally preferred to avoid medications unless necessary. Minimizing patient anxiety with clear explanations and reassurance, option A, is always beneficial for both the patient's comfort and the quality of the scan. Question 15. In a context of radiation protection principles, which of the following strategies best minimizes the risk of radiation exposure to healthcare personnel during ARRT? A. Use a lead apron for all procedures, regardless of the scan type. B. Maintain a safe distance from the patient and avoid unnecessary direct exposure. C. Rely on shielding for patients, as personnel should not be exposed to radiation. D. Perform all scans without regard to the patient's radiation dose to reduce the need for retakes. Answer. Correct answer. B. Maintain a safe distance from the patient and avoid unnecessary direct exposure. Explanation. The most effective method for minimizing radiation exposure to healthcare personnel is to maintain a safe distance from the patient during ARRT. This is in line with the distance principle of radiation protection, which recommends staying as far as possible from the source of radiation. While lead aprons, option A, and patient shielding, important, personnel exposure is best minimized by staying out of the radiation path when feasible, relying solely on shielding, option C, or performing scans without considering dose optimization, option D, is not recommended for safety. Question 16. What is the recommended approach when managing a contrast media extravasation during ARRT? A. Immediately remove ARRT and catheter and apply a warm compress to the site. B. Discontinue the scan and apply a cold compress to the affected area. C. Remove the catheter and report the extravasation to the physician, applying appropriate interventions such as ice and elevation. D. Continue with the scan and inform the physician afterward. Answer. Correct answer. C. Remove the catheter and report the extravasation to the physician, applying appropriate interventions such as ice and elevation. Explanation. Extravasation of contrast media can cause tissue damage, and it is essential to take prompt action. The standard protocol involves immediately stopping the injection, removing the Roman catheter, and reporting the event to the physician for further management. In most cases, applying ice to the site, elevating the affected area is recommended to reduce swelling and manage the symptoms. Continuing the scan, option D, is unsafe, as the patient's health should always come first, and extravasation needs to be addressed immediately. Question 17. Under the assumption that ECANA is functioning optimally, which of the following factors will most significantly affect the spatial resolution of CT images? A. The size of the detector elements. B. The use of higher mass settings. C. The scan field of view, SFOV. D. The pitch of the helical scan. Answer. Correct answer A. The size of the detector elements. Explanation. Spatial resolution in CT imaging refers to the ability to distinguish between small objects or details. The size of the detector elements, option A, has the most significant impact on spatial resolution. Smaller detector elements allow for finer image details, improving resolution, while mass settings, option B, influence image quality. They primarily affect image noise and resolution. The SFOV, option C, and pitch, option D, can influence other factors such as image coverage and scan speed, but they are less directly related to spatial resolution. Question 18. Considering the principles of CT image acquisition, which of the following best describes the role of convolution kernels in CT imaging? A. Convolution kernels control the number of slices that are obtained during the scan. B. Convolution kernels determine the speed of the CT scan process. C. Convolution kernels are responsible for enhancing or suppressing certain features in the final image. D. Convolution kernels are used to calibrate the CT scanner for optimal contrast. Answer. Correct answer. C. Convolution kernels are responsible for enhancing or suppressing certain features in the final image. Explanation. Convolution kernels are mathematical filters applied to CT data during image reconstruction. They influence the way an image is processed by enhancing or suppressing certain features such as soft tissue or bone details. This allows for optimization of the image for specific clinical needs, such as improved contrast, soft tissues, or edge sharpening for bony structures. The other options do not accurately describe the function of convolution kernels. Question 19. When addressing patient history and contraindications for CT procedures, which of the following is most important when preparing a patient with a history of kidney disease for a contrast-enhanced CT? A. Ensure the patient is hydrated to promote kidney function. B. Increase the contrast dose to ensure adequate imaging. C. Perform the scan without contrast to avoid potential kidney damage. D. Administer diuretics to improve renal clearance of the contrast. Answer. Correct answer A. Ensure the patient is hydrated to promote kidney function. Explanation. For patients with a history of kidney disease, proper hydration is essential. When administering contrast agents, hydration helps improve renal clearance and minimizes the risk of contrast-induced nephropathy. In some cases, adjusting the contrast dose, option B, may be necessary, but hydration is always a key factor in ensuring patient safety. Diuretics, option D, are not recommended as they could further compromise renal function. Performing the scan without contrast, option C, might be necessary depending on the clinical indication but is not always the first line of action. Question 20. To determine whether EKI has been optimally performed, which of the following factors should be assessed when reviewing the images? A. Image noise and its effect on the diagnostic quality. B. Only the clarity of anatomical landmarks. C. The presence of artifacts without considering the clinical context. D. Image magnification without regard to pixel size. Answer. Correct answer A. Image noise and its effect on the diagnostic quality. Explanation. Image quality in CT is highly influenced by factors such as noise, contrast, and resolution. Image noise can reduce diagnostic clarity and impact the clinical utility of the scan. Therefore, it is important to assess the effect of noise on the image quality, particularly in low-dose protocols or high-resolution scans. While clarity of anatomical landmarks, option B, is essential, it must be considered in the context of overall image quality, including noise. Question 21. During an EK of the chest, the patient begins to feel lightheaded and complains of shortness of breath. What is the most appropriate initial action? A. Continue with the scan and tell the patient to take deep breaths. B. Stop the scan immediately, assess the patient, and inform the physician. C. Increase the radiation dose to improve the image quality. D. Administer oxygen and resume the scan. Answer. Correct answer. B. Stop the scan immediately, assess the patient, and inform the physician. Explanation. Patient safety is the primary concern in any medical imaging procedure. If the patient experiences symptoms such as lightheadedness and shortness of breath, the scan should be stopped immediately. The technologist should assess the patient and inform the physician for further evaluation and care. Continuing the scan without addressing the patient's symptoms option or increasing the radiation dose option C could worsen the situation. Administering oxygen option D may be appropriate, but the priority is to stop the scan and assess the patient's condition first. Question 22. When imaging a pediatric patient for ARRT, which of the following factors is most important in reducing radiation exposure? A. Use the same adult CT scan protocol without adjustment. B. Limit the number of scans performed and consider alternatives to CT. C. Increase the exposure time to reduce the likelihood of motion artifacts. D. Provide reassurance to the child without modifying the scan parameters. Answer. Correct answer. B. Limit the number of scans performed and consider alternatives to CT. Explanation. To minimize radiation exposure, it is crucial to limit the number of CT scans performed on pediatric patients, as children are more sensitive to radiation. Additionally, alternatives to CT, such as ultrasound or MRI, should be considered when appropriate. Using the adult CT protocol, option A, without adjustments would expose children to higher radiation levels, while increasing exposure time, option C, would unnecessarily increase the dose. Although reassurance, option D, is important for patient comfort, it does not directly address radiation reduction. Question 23. In ARRT, what is the primary benefit of using a high spatial resolution technique for a brain scan? A. It improves the visibility of fine anatomical structures such as vessels and tumors. B. It increases the speed of the scan. C. It reduces the overall radiation dose to the patient. D. It decreases the amount of motion artifacts. Answer. Correct answer. A. It improves the visibility of fine anatomical structures such as vessels and tumors. Explanation. High spatial resolution is used in CT imaging to improve the clarity of small structures, such as blood vessels and tumors, which are often critical for diagnosis, especially in the brain. While it does not necessarily increase scan speed, option B, reduce radiation dose, option C, or directly address motion artifacts, D. It provides the ability to distinguish fine details in the scan, which is particularly useful for evaluating complex anatomical structures. Question 24. A patient is undergoing a ECNU with contrast media and an extravasation occurs. The patient's arm begins to swell. What should the radiologic technologist do first? A. Apply a cold compress to the area and continue the scan. B. Stop the infusion immediately, remove the catheter and notify the physician. C. Continue the scan without notifying anyone. D. Apply a warm compress and monitor the area for 30 minutes. Answer. Correct answer. B. Stop the infusion immediately, remove the catheter and notify the physician. Explanation. Extravasation of contrast media requires immediate attention to prevent further injury to the tissues. The first step is to stop the infusion, remove the catheter and inform the physician. Cold compressors, option A, may be helpful for swelling but should not be the first action. The priority is to stop the contrast and ensure patient safety. Continuing the scan without notifying anyone, option C, is inappropriate. A warm compress, option D, is not typically used in the early stages of extravasation. The cold compressors are often recommended initially. Question 25. When preparing a patient for ARRT, it is important to screen for allergies to contrast media. If a patient has a mild allergic reaction to iodine-based contrast during a previous scan, which of the following is the best course of action for the current procedure? Administer the same iodine-based contrast after premedication with antihistamines. B. Choose an alternative contrast medium such as barium sulfate. C. Discontinue the CT scan and do not use any contrast. D. Administer the contrast without any premedication as the reaction was mild. Answer. Correct answer. A. Administer the same iodine-based contrast after premedication with antihistamines. Explanation. For a patient with a mild allergic reaction to iodine-based contrast, the best approach is to premedicate with antihistamines to minimize the risk of a reaction. This allows the use of the same contrast medium, option A, in a controlled manner. Using an alternative contrast medium like barium sulfate, option B, is not ideal. It may not be suitable for the type of scan. Discontinuing the scan, option C, is unnecessary unless the patient has a severe reaction. Administering contrast without premedication, option D, could increase the risk of an adverse event. Question 26. A patient is undergoing an EK of the abdomen and pelvis, and the technologist notices some motion artifact on the images. What is the most effective way to reduce the artifact? A. Increase the scan duration to allow more time for the patient to remain still. B. Ask the patient to hold their breath during the scan to minimize motion. C. Increase the radiation dose to improve image quality. D. Perform the scan with the patient in a different position. Answer. Correct answer. B. Ask the patient to hold their breath during the scan to minimize motion. Explanation. Motion artifacts are common in abdominal and pelvic CT scans, especially if the patient moves during the scan. The most effective way to reduce motion artifact is to ask the patient to hold their breath during the scan. This minimizes the movement of the abdominal organs and improves the image quality. Increasing scan duration, option A, may necessarily reduce motion artifacts and could lead to unnecessary exposure. Increasing the radiation dose, option C, is not recommended as it does not address the underlying issue of motion. Changing the patient's position, option D, may not effectively address the artifact. Question 27. What is the most important factor to consider when choosing between a contrast-enhanced CT and a non-contrast CT for a patient with a suspected kidney stone? A. The size of the stone. B. The patient's ability to tolerate contrast media. C. The patient's blood pressure. D. The patient's age. Answer. Correct answer. B. The patient's ability to tolerate contrast media. Explanation. For suspected kidney stones, a non-contrast CT is typically the preferred option as it provides excellent visualization of the stones. However, when contrast is required, it is important to assess the patient's ability to tolerate contrast media, particularly if they have a history of kidney disease or allergies. Option B. The size of the stone, option A, directly impact the decision between contrast or non-contrast CT, as non-contrast CT is typically effective in detecting stones. Blood pressure, option C, and age, option D, are secondary considerations compared to the patient's tolerance to contrast media. Question 20. In CT imaging, which of the following factors primarily influences the contrast resolution of the scan? A. Slice thickness. B. 2 current MAR. C. Scan pitch. D. Reconstruction algorithm. Kernel. Answer. Correct answer. D. Reconstruction algorithm. Kernel. Explanation. Contrast resolution in CT imaging refers to the ability to distinguish between tissues of similar density. The reconstruction algorithm, or kernel, primarily influences contrast resolution by enhancing or suppressing specific tissue characteristics. Slice thickness, option A, influences spatial resolution, not contrast. 2 current MAR, option B, affects image noise dose, while scan pitch, option C, affects scan time and coverage, not contrast resolution directly. Question 29. A patient with a history of asthma is scheduled for a contrast-enhanced CT. What is the most appropriate preparation to minimize the risk of a contrast reaction? They administer a bronchodilator before the scan. B. Use a lower concentration of contrast medium. C. Administer antihistamines and corticosteroids as premedication. D. Skip the contrast medium altogether. Answer. Correct answer. C. Administer antihistamines and corticosteroids as premedication. Explanation. Patients with a history of asthma are at an increased risk of allergic reactions to contrast media. To minimize this risk, premedication with antihistamines and corticosteroids, option C, is often recommended. This approach helps to prevent or reduce the severity of allergic reactions. Administering a bronchodilator, option A, may be helpful if symptoms are present but is not a standard premedication for contrast reactions. Using a low concentration of contrast, option B, is not typically indicated, and skipping the contrast, option D, may not be feasible if the clinical indication requires it. Question 30. In a patient undergoing a EKG of the chest with contrast, which of the following signs or symptoms would indicate a possible contrast reaction? A. Swelling at the injection site and slight redness. B. Feeling of warmth during injection and mild headache. C. Sudden shortness of breath, wheezing, and facial swelling. D. Mild dizziness and slight nausea during the scan. Answer. Correct answer. C. Sudden shortness of breath, wheezing, and facial swelling. Explanation. A serious allergic reaction to contrast media such as anaphylaxis may present with sudden shortness of breath, wheezing, and facial swelling. Option C. This is a medical emergency and requires immediate intervention. Swelling at the injection site. Option A. And mild dizziness or nausea. Option D. A common but generally non-serious reactions. A feeling of during injection. Option B is also a common non-threatening reaction.